All right, I'll call the meeting to order. It was properly posted on March 14th. Is there a motion to approve the minutes of the regular meeting of February 16th and the special meetings of February 23rd and March 2nd?
Motion to approve. Second.
All in favor say aye.
Aye.
4 through 30 are the consent docket items.
Move the consent.
Is there a second?
Second.
All right, all in favor say aye.
Aye.
All right, and item 31 is a transfer of general fund for the court clerk in the amount of $15,000 from benefits to capital.
Move to approve. Second.
All in favor say aye.
Aye.
Item 32 is a transfer of general fund appropriations for health and safety in the amount of $20,931 from salary, benefits, and operation. This is necessary to move payroll for the Commissioner's financial administrator to the Commissioner's department, to the HR department.
Motion to approve. Second.
Is there any discussion?
Well, you're not very enthusiastic.
All in favor say aye.
Aye.
Danny, our monthly report.
I don't want to hog. All right. Good morning.
Morning.
Page 3 of the monthly report. The report up on the screen looks a little bit different than what you see in on the agenda, so if you wouldn't mind looking at the screen. This is a look at general fund through the end of February. To date, we've collected $69.1 million in revenue. That's 85.2% of what we budgeted. Last year at the time, we collected 84.5%, so we're right on track with where we need to be in collections this time of year. We ended the month with a cash balance of $25.7 million. Compared to last year, we were at $19.6 million. That's about a $6 million increase over the same time last year. Reason for that is revenue is up $2.4 million over same time last year. That's to be expected. We had actually budgeted about $2.7 million more, so right where we should be this time of year in revenue collections. Expenditures to date, when you compare this year's budget to last year's budget, we've actually spent a little more than $4 million less than we did the same time last year. That's an 8.2% decrease. That's a direct result. The Sheriff's Department's expenditures in general fund are down $4.1 million when you compare their expenditures to last year out of general fund.
But that's due to DOC withdrawal?
Well, they've been budgeted the full amount. I can't speak to the sheriff spending for this year. All I know is they've spent.
You're saying spending
out of their general fund budget, yeah. Okay. Overall, they've spent a little bit more over their special revenue funds, but their overall spending is down in total as well. I know John Scoot is here. He can address that.
Okay. Go ahead.
All right. Let's get away from the general fund. We'll take a look at employee benefits fund. Year to date, through the end of February, we've got a cash balance of $726,000. In medical and prescription claims alone, we've paid out $2.7 million more than we did this time last year. That's a 23% increase over last year. When you take February's numbers, project out the rest of the year, we project we're still going to end up at almost $1.6 million a deficit this fiscal year. We did move an additional $1 million last month from general fund. So the way it's tracking right now, it looks like we probably have to move at least another $1 million. Again, we're watching it month to month, hoping that trend goes down. But I can tell you, just looking at March's numbers, which is not on this report, March is looking to be one of our bigger months this year. So that's not good news going forward for the cash flow. So when you actually plug in March's number, that deficit of $1.5 million jumps to about $2.2 million. So hoping, again, that April, May, June will come in lower than what we've seen so far this year, but based on March's numbers, it's not looking that way. This is a report that's not on the monthly report, but I just wanted to kind of show you this is a comparison of just medical and prescription claims month to month compared to last year. The months highlighted in red there are months that we paid out over $2 million in claims, and then projecting March, since we have one more week of March to pay, that March will probably be over $2 million as well. So we're looking at 3 months this fiscal year where we've paid out medical and prescription claims over $2 million per month. If you look at last year, we didn't have 1 month that was over $2 million. So it just kind of shows you, comparing the last year compared to this year, why we're up so much. And now, the only thing that's kind of saved us so far this year is we've had stop-loss reimbursements in the amount of $722,000. That's reimbursed a lot of these claims that we paid. Last year, we netted $394,000 in stop-loss claims. So the reimbursement from stop-loss, the $722,000, that's helped us with our cash flow. That's really helped us through the month of March, which is why we're not recommending a transfer in March, because of the stop-loss reimbursements. Looks like we're going to be able to get through the month of March and be able to pay the bills on time. So, but look toward next month. You'll probably see a recommendation for another transfer from general fund next month.
Danny?
Yes, sir.
The stop-loss reimbursement, those are dollars, checks we've actually received and have been able to put into our account. Do we have any others sitting out there that we're waiting receipt of?
Talking to John this morning, he thinks there may be about $200,000 kind of pending that we could possibly see in reimbursements, and possibly more.
Any further discussion?
And I did mention last month, workers' comp is trending really well in claims paid, so we're still estimating workers' comp is going to end with a cash balance of about $700,000. So that's a potential funding source moving forward for employee benefits. So we may want to look at that next month, maybe potentially moving $500,000 or so out of workers' comp over to employee benefits instead of general fund reserve. So just keep that in mind as we move forward.
Do you have something on this item or for the next? Okay.
Thank you.
Is there any further discussion? If not, is there a motion to receive the report?
So moved.
Second.
All in favor, say aye.
Aye.
Now, John, 34.
A follow-up from where Danny left off. I handed out a 2-page report to everyone, and I really want to speak to what's driving the claims cost. I'm kind of probably sound like a broken record from last month, but why do we have a $2 million increase? I really want to speak to that and what's driving it, so you'll understand why those increases are there. The first page of my report shows members with high-dollar claims. And this is people that have incurred $62,000 or more in claims. Last fiscal year, at this point, at March, we had 24 people. This year, we have 31 people. So we have 7 more big claimants. And all in all, those big claimants have accounted for an increase of $2.1 million. So that's where the increase is coming from, those big high-dollar claimants. Now, the good news is we're working forward on that new network for the health plan, looking for a 7/1 implementation date. And what that health plan is going to, or that health network is going to directly impact those big claims because they have bigger, deeper discounts. So hopefully starting in July, we'll see some discounts from those bigger claims coming in. On the second page, it shows where our plan money is being spent. And the first 2 categories really speaks to those large claimants, inpatient and outpatient. That's where the increases we're seeing at. The high-dollar claimants are inpatient more, and then outpatient cancer treatments, et cetera. But that's where we're seeing our plan dollars spent. I netted some of those at the bottom. I netted out some of the refunds we received back directly related to claims. Danny's stop-loss numbers are a little lower than mine. I look at HealthSmart's numbers. I show this year we're about at $1.2 million in stop-loss reimbursements. Same time last year, we're only at $196,000. So stop-loss going forward from here on out, it's going to pick up a lot of those high-dollar claimants' costs. So, I expect some of those costs to go down as we carry forward through the fiscal year, towards the end of the fiscal year. I see stop-loss going to pick up a lot of those high-dollar claimants. So hopefully our claims won't trend as they have the first part of this fiscal year because, again, stop-loss is picking up a lot of those costs. Yes, sir.
That stop-loss doesn't count on individual claims, isn't it? Total claims?
No, we have individual, which is called specific. So anytime someone incurs $250,000 or more in claims, then stop-loss pays the rest. and we have about 10 members already at that point this year.
We also have an aggregate though, don't we? So
We do, and it's very hard to reach that. They've been at such a point, if we had a very catastrophic year, then we'd reach $1 million worth of coverage for that aggregate. So I just wanted to paint a picture of what's driving those claims costs. It's not that our plan's out of control by any means. Most plans across the nation experience a 16 to 20% increase every year. Although we haven't seen that luckily, this is one of our high years. But we have solutions to it.
Commissioner Johnson?
Thank you. Are these people who have a high pay difference here? Are they active duty people, or are some of them retired?
It's a mix. It could be an employee, a spouse, or a retiree.
I got you. Okay.
Yes, ma'am.
Okay.
Any further questions, John? If not, is there a motion to receive his monthly report?
So moved.
Thank you. Second.
All in favor, say aye.
Aye.
All right, an update from the BET. Cody?
Good morning.
Morning.
BET doesn't have any recommendations for this group today. When we did meet, we added 2 new items to the watch list this past Tuesday, both of them for the county clerk's office. One of them was for half the Tyler Munis payment of $249,438, and the other was for salary and benefits for employees that are currently on the records preservation fund, and that amount was $225,020. Those 2 items have been added to the watch list, so we will be tracking that. Currently, general fund reserve balance is sitting at just over $3.2 million. We have set a schedule. We're starting next Wednesday, meeting with departments to start the discussion on what their estimated needs are going forward for next year. So,
Questions of Cody? If not, is there a motion to receive his report?
So moved.
Second.
All in favor, say aye.
Aye.
Thank you, sir.
thank you.
Augie, report on Tyler Munis?
Good morning, everyone. Hi, this past week we had Maureen Gelinas out from Tyler Technologies. She was on site from March 7th to March 9th, and she helped the county with the evaluation of the bids and contracts module in Munis, and she spent some time in the accounts payable department helping the ladies look at ways of getting, invoice entry, working a little better, and she was a big help to them up in AP. And we're going to be reviewing bids and contracts to see if it's going to fit for the county, and if it does, then we'll go forward with it. But if it doesn't, then maybe next year we won't. It may lower the cost of Munis if we don't use it. So she'll be back. Maureen will be back on the week of April 24th to focus back on receiving and possible review of maybe budget projections and stuff like that with you, Danny. And working on a few reports, a couple for payroll, HR, personal actions entry. I emailed you and you got copies of that, so let me know if you need changes on that or whatever. So, and I modified a few for work orders and the work order report and spending report for that me and Rob worked on for check out the accounts to see if you're over your, or getting close to your budget. So, and if anybody needs any help with, any of the budget reports that I have written, or if you need anything else written, give me a call and we can work on it and take care of it. So,
Questions of Augie?
That's it.
If not, is there a
Thank
motion to receive his report?
So, second.
All in favor, say aye.
Aye.
Thank you, sir. Elected official comments. Danny?
Nothing.
Mike? Nothing. Willa?
Nothing.
Okay, Ray?
I was wondering if we'd heard from the sheriff's office. Is PD not available today?
He cannot serve as a member of the
Oh, that's
budget
right,
board
he
based
can't
upon the DA's decision.
Forgot that. Thank you.
But I'd like to kind of follow up on that. It's critical that we have input, I think, from the sheriff's department, because that's where all the money's, let me rephrase that, that's where a lot of the money's being spent. I don't know if Danny, maybe we put a permanent item on here just for an input from Sheriff's Department, but, I do appreciate John being here, and certainly I do think, they may not be a voting member, but I do think it's incumbent upon us to receive a report from them and see how things are going with them, if they've got some issues in the financial area in particular. So, I don't know how best to approach that, but I do think we've got to have some way to have an input from the Sheriff's Department.
I couldn't agree more.
Thank you, that's better stated than I could have done.
That's normal.
Leonard?
None.
Ray,
Okay.
Ray.
Any citizens to be heard?
Would you do it? Thank you.
If there are none, is there any new business? Seeing or hearing none of items 37 or 30, well, we had a 37.5. I guess we'll report that as a Scrivener's error there. But anyway, is there any motion to recess into executive session?
Second.
All in favor say aye.
Aye.
Okay. Is there a motion to go back into regular session?
So moved.
All in favor say aye. Aye. Now, is there action on our executive session item?
We've got a motion.
Mr. Assessor.
Can we put a 12-month cap on this and then review it at the end of 12 months?
Second motion.
Are you wanting to offer a friendly amendment?
Well, I don't know that I can since it's on the floor.
Well, they could be amenable to an amendment if you're wanting to.
Would you be amenable to starting at 6 months? It's gonna be reviewed by our
Yeah.
healthcare provider.
Accept that amendment.
I am not. So you'll need another second.
Okay.
Are you withdrawing your second?
I am withdrawing my second.
I'll second.
I feel strongly that we need a year to give this person a year's opportunity.
Well, a year may, if 6 months works, then certainly a year, then it's gonna be extended.
But still not in favor of it.
Okay.
Any other discussion? You agree, you understand the motion, Karen? Yeah, to be subject to renewed, consideration at 6 months. Is that correct? Any other discussion? Not, there's a motion and a second. All in favor say aye.
Aye.
Any opposed?
No.
Okay. Is there now a motion to adjourn?
Just be sure my no is stated with the comment that, because I strongly feel it should be 12 months as opposed to just 6. I don't want to know as if I'm against any assistance at all for this individual.
Let the record reflect he's against children.
Yeah, yeah. Damn 'em.
Okay,
Was there a motion to adjourn?
there, I think, second.
Second.
All in favor say aye.
Aye.
Thank